Are you ready to discover a powerful approach to shoulder issues that requires only 2 needles and delivers results in 20-minute treatment times? Welcome to today's episode, where we'll uncover the best electroacupuncture strategy for shoulder pain and dysfunction. If you're an electroacupuncturist seeking a reliable, rapid relief technique for patients experiencing issues like biceps tendonitis or frozen shoulder or just about any shoulder issue, you're in the right place. In the next couple of minutes, we'll explore the fascinating world of electroacupuncture, focusing on diagnosis through the acupuncture channels or tissue location, and how we can use electricity to spark cellular regeneration and effectively treat shoulder pain and dysfunction. Make sure to watch the video and join us on this journey to better your practice and your patients' lives. Remember to subscribe and stay tuned for more invaluable insights. And feel free to share this with a colleague who could benefit as well. Let's learn together and elevate the field of acupuncture. All right, let's talk about the shoulder dysfunction, shoulder pain, shoulder inflammation. There's only one disease in the world, and that is a poor terrain. And that is the principle that we're working with. All disease is a lack of electricity. Now, when the voltage drops or when the electricity is deficient in an acupuncture channel, that causes a magnetic field which creates pain. So pain can become a main diagnostic feature about which channel or nerve is deficient. So this is the system I use for all disease, including shoulder dysfunction. And I run through the system with every patient on every treatment so that I ensure I cover all my bases. So let's focus on the pattern diagnostic section here in bold. So number one, which acupuncture channels are deficient, failing to feed enough electricity into the associated organ or tissue for cellular regeneration or proper function? Now, the acupuncture channels have the number one most electrically conductive tissue of the body, and that's the fascia. Now, the second most electrically conductive tissue of the body is the epineural covering of nerves, peripheral nerves, such as spinal nerves. So this step number one, you could diagnose which channel is deficient, or you could diagnose which nerve is deficient. It's totally up to you. You could do some sort of combo on both, with both in the diagnostic process if that interests you. Now, in all cases, I only use 4 needles. 4 needles is totally enough. Now, step 2, which of the 7 Chi leaks is present? And we need to address these, even in a shoulder issue. You may be saying, well, Dr. Jeremy, why would I address a dental issue if the patient came in with a shoulder current complaint, right? Well, think about mercury, for example, which is in a lot of people's mouths. Mercury takes the mitochondria, which is a major chi generator, and it prevents it from producing ATP, and instead it starts producing hydroxyl free radical, leading to inflammation. And where does this inflammation go? Well, it goes in the central circulatory system, and it ends up into the tissues of the patient's problem. For example, we're talking about shoulder. If somebody has an old shoulder injury and they're getting inflammation from the mercury in their mouth, then we can address the mercury in this example to tone down the inflammation. So you're going to want to address, follow this system, follow along for any patient, any disease, and address, diagnose, do they have any of these issues? And if they do, address them directly with an acupoint or 2. And then, of course, we need Gu Qi plus or minus, I wrote here. What's that mean? Well, we need to subtract things out of the patient's environment, out of their diet that is increasing their disease. If they are eating and drinking inflammatory foods, you need to work on pulling that out of their diet. If they hold their cell phone and it's making their shoulder problem worse, we need to work on pulling that habit out of their life. Now, Gu Qi additions, like I always use the example, if the thyroid needs to produce thyroid hormone, how can it if there are 0 molecules of iodine floating around in the patient's system? So we have to tackle Gu Qi. And that's an overview of the pattern diagnosis that I go through for any problem. Now let's focus more on the shoulder. And there's a few ways to do this. We can do it by Acuchannel, which I said which channels are deficient. So the patient comes in, right? And by the way, this is a free resource available for download for you. The patient comes in and you say, okay, where's your shoulder pain? And they put their finger on the lung channel here or the large intestine channel here. Even if it's biceps tendonitis, that tends to be on one of these two channels, right? So when they're pointing, they're making the diagnosis for you that one or more of these channels that they're touching, where their pain is, has become deficient. Remember, we started by saying when there's voltage decreased, it creates a magnetic field, which creates pain. Then, when you fill up these channels with electricity, the proper type of electricity, then the energy that you provided now re-sparks cellular regeneration and proper function and reduces inflammation, and they can sometimes feel a different type of pain, which we call Da Qi. So that's something you may want to inform your patients, that if you treat them and now their pain is different pain, that's a very good sign that your treatment is working. So we're doing it on channels, right? So far, I'm talking about channels. So if you find a deficient channel, you want to fill up that channel from a point that is early on the channel or late on the previous channel. What do I mean by that? I mean, if the lung channel is deficient, you want to select lung 1 or 2 because that's early on the channel. Channels flow unidirectional with the numbering system. All 12 channels are numbered correctly except for the Ren channel, which flows downward instead of upward. Now, let's say the pain is in the back. They point to here, the small intestine 14 area or small intestine 10 area or Sanjiao 15 or any of these. They are diagnosing themselves of which channel is deficient. So you can choose a point early on the channel. For example, if Sanjiao is your diagnosis, then you can choose something like Sanjiao 5. It's early on the channel. The qi will flow into Sanjiao 5 and then throughout the numbering system all the way up into past Sanjiao 14 here and fill up that entire channel and start your patient on the journey to reversing their disease. Okay, more ways to do this. Well, all these channels also exist on the ear. So if you want to treat channels from the ear, that's totally fine. Now I'm going to show you that we can treat this through, remember, I said which channels are deficient or nerves are deficient. So you can use a dermatome chart. You can treat the spinal levels associated with the dermatome chart for your patient's disease. I like to treat on the ear, and we have all these spinal levels on the ear here, and the nerves are the upper third of the concha wall here. And what I love to do is I take my point finder, I use the new EAM Special Edition Pointo Select, and I measure for electrical resistance because all disease is a lack of electricity or benevolent qi. And when this qi decreases in an organ tissue channel, That also decreases the electrical resistance, and these point finders are measuring electrical resistance, and the point of select never lies. So if I have a shoulder pain issue, I come to this cervical or upper thoracic vertebrae area and I search on the upper contra wall for the most bang for my buck point. Where is the most deficiency? And that is a way of treating the spinal nerve associated with the shoulder pain. Now, another thing you can do is you can focus on the tissues here in green, because the vertebrae is on the ridge here. When you roll off to the inside on the wall, now you're into the spinal nerves. But when you roll off to the lateral aspect, now you're into the muscles, the bones, and tendons. I recommend taking a point of select or some sort of point finder. If you don't have one, then use a probe to check for points in this area here. You will be able to locate the specific tissue that is diseased, mark it, stick your needle, electrify it, fill up that tissue with this benevolent chi so that the patient's body system can take that negative charge, improve the terrain, use it to start regenerating cells, use it to decrease inflammation, decrease pain, and get your patient shoulder issue moving towards health. And these are the most effective protocol. What I'm showing you here is what I do in my own clinic. I only use 4 needles. The other thing is that one of my needles is always the blood electrification treatment. So if you don't know what that is, go back into my YouTube channel and you should be able to find it. But basically, you feel for the radial artery, you slip a needle obliquely alongside the radial artery, and you insert electricity into the circulatory system, which is improving the environment of the circulatory system. The circulatory system meaning where the red blood cells are and the white blood cells. And the white blood cells are responsible for creating these inflammatory and pain neurotransmitters. So we want to provide enough energy there, and that's why every single one of my patients gets a 1 needle blood electrification, and that leaves me 3 needles to choose from, either a channel or a nerve or a tissue like I'm showing you, or possibly one of these 7 Ichi leaks. Now let's talk about frequency. If you're using a lower voltage device like an Ito, a Pantheon, or an AWQ, I want you to use 2 machines, one set to the fastest frequency, such as 500 hertz, and the other set to 2.3-ish hertz, because that's our beta endorphin for painkiller, and ACTH frequency for anti-inflammatory. Now, if you're using a higher voltage device, such as the new EAM Special Edition Point of Select or some other higher voltage device, then you're still going to use 2 machines, 2 frequencies, but one machine should be set to 4.6 hertz, because that's what the blood electrification treatment is. And also 1 to 5 hertz, it's still in the category range of beta endorphins and ACTH. The other frequency you can select using this Noget chart. So if we're treating shoulder tissues here, it's in yellow, we can select this 9.1 or 10 hertz mesoderm musculoskeletal frequency for good results. When you use the higher voltage machines, when you use 2 frequencies, you get blanketing resonance effects. I made my previous blog on this, so go to the YouTube channel or read the blog on frequency blanketing resonance effects if that interests you. And there you have it, the best electroacupuncture strategy for shoulder pain and dysfunction. I hope you found this episode insightful and valuable in elevating your practice and providing rapid relief to your patients. Before we wrap it up, I'd like to remind you to hit the subscribe button so you won't miss out on any future episodes, which are packed with more essential electroacupuncture knowledge. Now, if you'd like to dive deeper into this topic, be sure to head over to our blog and read the in-depth article. And don't forget to download the free resource that accompanies this episode. Help us spread the word about this powerful treatment approach by sharing this content with a colleague who could benefit from it. Together, we could advance the field of acupuncture and make a positive impact on countless lives. Lastly, if you're interested in exploring more of my electroacupuncture courses and taking your skills to the next level, visit www.electro-acupuncturemedicine.com. I look forward to guiding you on your journey towards becoming a more knowledgeable and skilled electroacupuncturist. Thank you for joining us today, and I'll see you on the next episode.